Let me see. Just give me 1 second.
Oh, what have I done? Oh, go on, Benny, what have I done here? Ollie, do you know what I've done here?
Just press mute on the click on.
No,
Put your
I've lost the screen altogether. Why have I lost the screen?
message me privately, please.
Oh, got
just
it.
press mute.
Got it.
I think Ariel's just trying to let more people in because we've got people in the waiting room trying to get in. I'm not sure what the capacity is, if it's 100 or over. I think that's what the issue is. So just give her a second to sort it out.
I'm so sorry, everyone, for this confusion. We have a bit of a capacity problem. That's the thing. So we'll see what we can do. I'm trying to fix something, but I think we just need to start since we're already over time. I am recording this one, so we can share it with people that can't come in. So let's just start from now because I don't want people, and also not our special guest waiting. So thanks for the patience. Welcome everyone to this webinar about brain health. We know that brain health is crucial also for overall well-being. And of course, it has an impact on many things. And that's what we're going to talk about today. Just for if there are some new people in here today, I just wanted to share a couple of slides as an introduction. So what we know is that, of course, the changes in the food industry the last decades has a very big impact on the mental health. Sorry, I just need to stop to share. It's a bit messy because I just lost my co-host. So I just need to get someone else to be co-host. Ali, can I make you co-host? So because if not, it's taking over my screen a bit. And if you see Vibeke, let her in. So we're just gonna go back to a couple of thoughts on the just in general what food and nutrition has done to our health the last decades. There we are. Just gonna get my full screen. We know many of us, so many of us here today has a lot of knowledge around this topic, but also for new people in here today. The last decades, the way we eat has impacted all our physical well-being, and we used to eat food from Mother Nature. So we had nutrition or a food pattern rich in vitamin, minerals, microphytonutrients. So we got all the things we needed from the food we ate. We also had high levels of fiber in our diet and also a good balance between fatty acids. And I'll go a bit into that if you're new here, so you understand a bit the importance of these things for our health. The fact that we got all these nutrients gave us a really, or had a really good impact on our bodies. And with the changes in the food industry, the man-made food, so the fact that we started to have the mass production, we got nutrients or calorie-rich food and less nutrients in the food. So it's high in sugar, empty calories, but also low in fibers, which also has an impact on the gut health. And we had, it also gives us an imbalance between fatty acids and essential fatty acids like omega-6 and omega-3, which we will talk more about today. And omega-6 and omega-3 is also really important for cell health, but just this kind of diet that we had, the industrial diet, causes problems in different areas for us. So then we're talking about inflammation, dysbiosis, so problems with the gut microbiota. We also experience type B malnutrition, meaning that we don't get enough of the nutrients we need every day, and also the glycemic mismatch. So we're talking also about the blood sugar changes that we see with high sugar food. And of course, it's very important to look at what we can do to change this and actually give our body a better, or at least to impact the health in a good way. The cell function, I'm not going to go into anatomy here and talk much about the cell structure, but it's important to understand the importance of these vital nutrients and also the balance between omega-6 and omega-3, because it has an impact on the cell rigidity. So meaning that we have fatty acids in the cell membrane, and if we have an imbalance in these essential fatty acids we're talking about, it will also shortly and easily explain less nutrition in and less waste out of the cell, so it will impact the cell function. Just to talk quick about the omega-6 and omega-3, if you haven't heard about it, there are essential fatty acids. Essential means that we need them every day and your body doesn't make it. So you can only get them through food, and omega-6 is, or we need to get them through food, and omega-6 is inflammatory. So we need it for immune function. We need it if you cut your finger, you need it to stop the bleeding. So it's vital to our health. And omega-3 is also an essential fatty acid that your body doesn't make, and we need to get it also through food every day. And that's, as you see, more the fatty fish. Also, we have plant-based omega-3 in the walnuts and different other sources. And this is anti-inflammatory. And it's very important for us to balance these fatty acids for optimal health. Just quick on, we need, science say we should have a ratio around 3:1, so 3 omega-6 to 1 omega-3 to stay in the healthy range where your cell and your body thrives. And we're going to talk more about these essential fatty acids in a bit. What's important is that, of course, when we talk about health, is that test-based nutrition, the power of proof is very important, that we can go in and measure and look at these fatty acids and the ratios we have. So it empowers us to actually do something about it and change our health. Next thing, the gut microbiota. I'm not going to talk much about it, but it has a really big effect, and also an important effect on our immune system. But also there's a lot to talk about these days, how the importance of gut health when it comes to mental health, brain health, and it gets impacted on many things. So the diet we eat, the medication we take and everything, but that's something our guest will talk more about in a bit. And type B malnutrition, the fact that we don't get the right nutrients or enough of the right nutrients for our body to function optimally. So that was just a brief walkthrough for new people in here. So you at least understand the basics of what we're going to talk about in a bit. And then I would like to welcome our guest. And you have all seen him already. Dr. Paul Clayton is a clinical pharmacologist and a pharmaconutritionist, and he is going to talk to us about all these, or the importance of nutrition when it comes to brain health. I'll just give you the word, Paul, and you wanted to do a brief intro on just in general on the topic we're talking about, and then if you have any questions, please put them in a chat so we can go through them in a while, and I'll read them to him if necessary. I'll open up so you can unmute yourself and ask him the question yourself. Dr. Paul Clayton, welcome.
Thank you. I hope that what I have to say isn't disturbed too much by some construction noises in the background. I think some work is being done in the studio next doors, and so that's bleeding through into this space. I hope it's not too distracting. So should we be concerned about brain health? Yes, I think so. I'm not going to show you lots of slides. I've got too many of them, but let me present to you the problem in its broadest sense. We are seeing an increase in the rise of all the different types of problems that indicate that the brain in the modern environment is in distress, that it is not able to function properly, that it is increasingly vulnerable and compromised, and made so by the modern diet and lifestyle. Lots of ways of looking at this. Perhaps one of them that is most people are familiar with has been an astonishing increase in the numbers of children who are on the spectrum. Now, when I went to medical school many, many years ago in 1968, we really didn't see very many cases like this at all. Oh, I have to confirm my speaking language. Okay. Which I've now done. As far as I know, it's English. Are you live? Gorel, can you hear me?
Yes, we do.
Okay. Okay, so this is the neurodevelopmental problems we knew about a generation ago, but we didn't see them on the scale that we see now. The frequency in some populations is considered to be as high as 1 in 23 or 24. That has definitely increased. We see an increase also, a huge increase, in the numbers of adults and particularly of children diagnosed with affective disorders, that have generalized anxiety conditions or depression. There is evidence also of an increased frequency of children who have, and adults who have, reduced impulse control. And all of these talk again about an environment in which the brain is not being allowed to function adequately or properly. At the other end of the age range, we have seen a huge increase in the numbers of middle-aged and elderly patients who are being diagnosed with neurodegenerative disease, such as the dementias, including Alzheimer's and Parkinsonism. All of these things together are saying our brains are under threat. And as if further evidence wasn't required, some of the really alarming data that's come out of Domini's group over the last few years is evidence of a gradual but sustained decrease in intelligence that he's been able to map all the way back to 1900. So ever since 1900, we have been becoming more stupid, and that trend shows no signs of letting up. All of these things together are telling us that our brains are being damaged, and all the evidence suggests that that damage starts very early in life, in fact, before you're born, while you're still in utero, and continues until your increasingly premature end. Now, I'm not talking about the types of clinical conditions affecting brain function, which we see, for example, in diseases of the liver, hepatic encephalopathies, for example, or the decrease in brain function that we see following on from advanced kidney disease. Really, those are conditions where you should be going to the source and treating the basic problem. So I'm not going to talk about that, but what I will talk about, if you will humor me, are the ways in which the four main drivers of degenerative disease are affecting us and affecting brain function. So very briefly, chronic inflammatory stress resulting in neuroinflammatory stress, because if you have chronic inflammatory stress in the body, it's likely to be affecting all of your tissues, including the brain. And we know a number of areas of the brain which are particularly vulnerable to neuroinflammatory stress. And once they are stressed, if this is happening in utero, at a time when the brain is developing and it's wiring itself and trying to find the right connections, chronic inflammatory stress appears to interfere with that, preventing the brain cells from going to exactly where they're supposed to go. And this appears to be very implicated in the neurodevelopmental disorders. I think that is fairly familiar. What is perhaps less familiar to some of you is that we're seeing an increase in schizophrenia. And some people are saying that schizophrenia should also be regarded as a late onset neurodevelopmental disorder, rather related to being on the spectrum, presenting in a different way and a slightly delayed stage. Another aspect of this that you might not have been so familiar with is the fact that we are seeing more people developing epilepsy of one sort or another. People seem to be convulsing more readily than they did a generation ago. And that may be a reflection of our deteriorating 6:3 ratio in our diet, therefore in our cell membranes. And that deteriorating ratio actually makes or tends to make neurons and other cells hyperexcitable. So that seems to be fitting into that. That is also related to neuroinflammatory stress. Dysbiosis comes in here too. If you have dysbiosis, and almost all of us do, then you run immediately into problems with colonic epithelial barrier function. So this is known colloquially as leaky gut. If you have the wrong or insufficient amounts of fiber in your diet, and our intakes of fiber have declined by 2 orders of magnitude if you go back a couple of thousand years, you end up with a population of microbes in the gut, which is predominantly proteolytic rather than saccharolytic. In other words, they like to eat protein rather than prebiotic fibers. When you have a microbiota like that, that inevitably leads to leakiness of the normal colonic epithelial barriers, and some rather nasty compounds start to leach into the blood, including lipopolysaccharides, which lead to chronic inflammatory stress and neuroinflammatory stress. But it's more than that. The brain is particularly affected because under those conditions, some things seem to start happening via the vagus nerve, this so-called gut-brain connection. Here, it looks as if the new population of microbes, the wrong population of microbes, is producing proteins and malfolded proteins and possibly inflammatory toxins, which are migrating into the brain up through the vagal nerve. And quite recently, it was shown that in patients who'd had a vagotomy, that is, in whom the vagus nerve had been cut, the incidence of Parkinsonism, amongst other things, was reduced. It didn't cut it completely, but it reduced it by about a half, because we also know that a similar dysbiosis in the mouth, and I know people think of dysbiosis in the colon as important, dysbiosis in the oral cavity is just as important. And this is, of course, even closer to the brain. So if you have the wrong population of microbes in your mouth, that has also been shown to lead to the production of toxins and inflammatory mediators, which migrate into the olfactory bulb and then pass retrograde into various parts of the brain. And this is also a risk factor, certainly for Parkinsonism and likely for Alzheimer's as well. Then you have glycemic mismatch, which Goral referred to. That describes a situation where we're eating an unprecedented amount of sugar and simple starches, thanks to the modern industrial kibbles that people are addicted to. And we could probably get away with that if we were all as physically active as our hunter-gatherer ancestors used to be. Because under those conditions, your muscles are soaking up all the glucose up out of the bloodstream and using it for energy. They turn it into ATP, and that's what allows you to move from A to B. It also helps keep you warm. Well, we're unprecedentedly physically inactive thanks to modern technologies. We're very predisposed to be seduced by labor-saving technologies, and there are evolutionary reasons why that is, but it creates a fatal combination. Lots of glucose pouring into the bloodstream, and we don't remove enough of it. We become hypoglycemic, we develop metabolic syndrome, and we move imperceptibly to clinical type 2 diabetes. Now you have glycemic stress, which results in the glycation of structural proteins and other molecules. Proteins which should do certain things start sticking together. They can't do those things. You're forming what are known as glycation end products. And these stimulate inflammation as well through what is known as the age-rage interaction. So this also contributes to overall a neurological deficit and in the long term, neurological damage and disease. So there are many aspects of the modern diet and lifestyle, which together mean that we are seeing more children with neurodevelopmental disease. We are seeing more middle-aged and elderly people with neurodegenerative disease. We're seeing more anxiety. We're seeing more depression. You could argue that we're also seeing more crime, because if you have neuroinflammation, there is evidence that your impulse control is reduced. And if you have less impulse control, you're more likely to be susceptible to instant gratification. You forget deferred pleasure. You want to do something. You want something now. That is a high road to criminality and a criminal record. So this is an unhealthy situation. It's stopping us from thinking clearly. It's stopping us from keeping our brains healthy over our lifespan, and it is cutting back on our intelligence. If that's frightening, if that depresses you, or maybe you already have depression, that's very common. It's meant to do that. We have a real problem, and all the drugs in the world, everything the pharmaceutical industry has to offer us, are not going to help. Yep, we can all doze ourselves into oblivion with anxiolytics, with tranquilizers, antidepressants, all the rest of it. They're not the solution. They treat some of the symptoms of these underlying problems not very well, and with a whole range of problems that they bring with them. We can only stem the underlying problems and push these tides of disease and dysfunction back to the much lower levels that they used to be at by using better nutrition and by using the pharmaconutritional tools that we have in our portfolio. So that's the big picture. Now, I'd like to throw the floor open, and people might have specific questions that relate to any one of these areas. You can ask whatever you want. I will do my best to answer. I can't promise I can answer every question, but I'll do my best.
That's good. I would like to talk about children. I know that a lot of people, it's a concern, like you talked about the disorders. So we're seeing much more of the ADHD and the ADD autism disorders. Children grow up in the middle of the industrial diet, but is it, maybe you could share a bit about, is it only the children's diet, or does it start already before conception? So with actually parents being unbalanced, having inflammation, having gut problems, is that something we see does that have an impact on the change we see in?
Oh, absolutely. Absolutely, because the child's diet starts with the mother's diet. When that child is in the womb and it's developing, the diet that it is consuming through the placenta is a reflection of what the mother is eating. Now, we all know that eating folic acid supplements is one way to help to reduce the incidence of neural tube defects. That's just the tip of the iceberg. everything else that the mother eats will have some impact, greater or lesser, on the child's status, its health, and its growing capabilities. Undoubtedly, if the mother is experiencing inflammatory stress, and that can have many different causes, that does increase the risk of a malwiring taking place. That is, the nerves in the developing brain of that child making some of the wrong connections. Now, that chronic stress that the mother's being exposed to, might come from an infection. It might come from an inflammatory disorder, such as rheumatoid arthritis. It might come from cigarette smoking, which is pretty pro-inflammatory, or it could even come from repeated social defeat. So if you're living a miserable lifestyle and you're getting, for example, abused in one shape or form or another, and increasingly we all are by our out of control political class of degenerates, yes, that increases the risk of neurodevelopmental disease.
Yes.
But can I make an addition to that?
Yes.
Because there's always more. There is some very interesting work done by a man called John Haidt, an American scientist. He's been looking at the impact of exposing our children from very young ages to mobile phones and laptops and iPads, where you've got very rapidly moving series of different types of stimulating impulses. That also now is increasingly be suspected as contributing to a kind of malwiring of the developing brain. And so I think that children's brains these days, I'm predisposed to think everything's nutrition. Well, actually, I don't. The real world is more complicated than that. I think that if the child's brain is being incorrectly wired or encouraged to be wired in the wrong direction, by being exposed to these very artificial stimuli, this is really outside our evolutionary heritage. And then if you overlay on top of that all of the nutritional problems that we know that the modern diet creates, this is a recipe for incorrect development of the central nervous system. Taken together, I think they account for the greater part, by far the greater part, of the cases of ADD, ADHD, dysphasia, dyspraxia, Asperger's, and all the rest of them that we're seeing today.
So what can we do? So children grow up with impact from their parents, but also, of course, eating highly processed foods. What can we do to change this? So how can we help?
I think one of the very easiest things we can do is that we should tell mums, expecting mums and all women of childbearing age, anyone who's going to possibly become pregnant, it's not just folic acid. You need much more than that to give your child a solid nutritional foundation and the chance to develop to their full biological potential. Stopping chronic inflammatory stress is a part of that. And I would say that something like balance oil and xenobiotic, which together reduce the overall chronic inflammatory stress anyone is going to experience, is a really solid foundation. That is honestly where I would start.
Could you also talk a bit about the gut, so the gut microbiota when it also comes to these conditions, and how we can change, help to start making a change there too?
Well, as I said, I think this is something that would be useful for mums or women of childbearing age, because by establishing eubiosis, that is a correctly configured colonic microbial population, you're reducing a source of inflammatory stress. So right away, that's a good idea, and to start that from before birth. This is something that really you would like children to be involved with after birth as well, from the moment they can start eating solid foods. I think that a certain amount of prebiotic fiber has to be a part of their diet as well. And if all they're going to be eating is junk, you should add prebiotic fiber to that. If you have the incorrectly configured microbiota, that will lead to all kinds of problems, because it's not just what happens in the colon that is the real problem here. That may be where it starts. But what you have to remember is it's not just one microbiota. There's not just one microbial population in the body. There's another one on the skin. There's another one in your bloodstream. There's a microbial population in your brain. There isn't a single tissue or organ that is sterile. The microbiota in the gut is the largest. And if that starts to slip out of balance and move into a modern really fundamentally pathological configuration that has negative knock-on effects, I think, on the microbiota in every other tissue. And I believe that includes the central nervous system. Now, this is a really interesting area to research. People are starting to look at this. I don't have much to report on it yet, but I think that's a real thing. And I think what we will find is, as we go forwards, that establishing a healthy microbiota in the gut actually can be shown to have considerable knock-on effects, positive effects, in every other tissue, including the brain and in brain-related behaviors.
When we talk about
could I just say, there are some preliminary clinical studies that show that prebiotics do have, for example, some antidepressant and some anxiolytic effects. So that already is beginning to show the robustness of the gut-brain connection.
Interesting. When we look at the disorders, so the ADHD and the autism kind of disorders, what can we expect from feeding, so giving the right nutrition, and so reducing inflammation, also talking about optimizing gut health, but also when we look at the type B malnutrition, adding the nutrients in. What's your experience, and what could we expect in those disorders without talking, so more in supporting children with these conditions?
Well, I would always start with bone soil and xenobiotic, and then add Viva as a possible add-on in some cases, because we know that saffron is as effective in helping these children as methylphenidate. A recent trial has just come out which says exactly that. This is a very potent intervention. I would think that adding all the other vitamins and minerals and phytonutrients, I think it also plays a role, but I would put that in the second tier. I can talk about some specific cases that we've seen, and I can say that with this combined approach that I just outlined, first of all, you can see the rationale for some of this in my blog. If you visit my blog and use neurodevelopmental as your search term, there's a lot of information there. But in terms of actual cases that we've dealt with, I've seen some remarkable improvements. Last time I was in London, I was asked to come up and talk to a particular lady who had her son with her. He was, I think, in his late teens, early 20s. We had a really nice conversation. And then she said to me, "You'd never guess, you'd never know, but my son had a serious neurodevelopmental condition that meant that he could not hold down a job, he could not maintain a relationship. His antisocial behaviors were such that he was beginning to accumulate a criminal record. And you could see the arc of his life taking shape, and it was a very dark arc. I didn't realize that would rhyme quite so well internally, but it wasn't. His future prospects were bleak. She found out about the health protocol somehow and persuaded her son to take it. And he now has a job. He has a steady girlfriend. He is being promoted at work. I mean, the turnaround has been quite fantastic. And this lady threw her arms around me and said, "You've given me my son back." It was very moving, very moving. I think Vibeke was there at that meeting, I think, and she might know who I'm talking about. And then we have other cases where the improvement has been so dramatic that the pediatric neurologists involved have said things like, "This child no longer has ADD or HD, or this child no longer has Asperger's." And that's extraordinary, because in all my previous years, I had never heard of anything like that at all. So I do think this is beginning to redraw the map of what these neurodevelopmental disorders are, who can be treated, and what we can actually achieve. Now, could I just say, I'm very cautious about medicalizing everyone. I think if someone is on the spectrum and different, and they have their talents, and they're using them, and they've compensated for who and what they are, and they're comfortable with who they are, and there are plenty of people who are just like that. I cherish people's differences. They will have something to contribute. On the other hand, I think that if you're talking about a child whose condition is such that they are effectively disabled, that their potential future, their potential career is severely curtailed it seems to me that that presents a much more compelling case for intervention. And if you are going to interview, and I would always want to use a pharmaconutritional approach first and leave the drugs as a last resort, because we know what the problems associated with the drugs are.
Just need to mute. Thanks. I have a question. I'm just gonna start to do some questions also from the chat. There's one here that says leaky gut refers to the large or the small intestines with a question mark, or both.
It's really the large intestine.
Large intestine, yeah. And our great xenobiotic supports the bacteria in the large intestines only.
Correct.
How can then the leaky gut phenomena in the small intestines be helped? But you already said it was in the large, so.
Okay, everybody knows there's a microbiota in the large intestine. There is one in the small intestine as well. Okay, there's no sterile tissue, no sterile organ. If the bacteria in the small intestine are kept within reasonable levels, then as the prebiotic fibers pass through, that's not an issue. But we do know there are some people who have excessive amounts of different types of bacteria in the small intestines, and they have to go on either the FODMAP diet or the carrot soup cure, following which they can use xenobiotic. But you have to flush those bacteria out of the small intestine first, because if you don't, you're going to have bloating, you're going to have pain, and you will then, under those circumstances, start to degrade, I think, the epithelial barrier function in the small intestine too. Although what subsequent adverse effects that has, I'm not sure, and I'm not sure anyone else is either. So who is likely to develop that type of problem? Who develops SIBO? Well, it's typically people who have been using antacids for long periods of time. The acid in the stomach is part of your innate immune system. It's to protect you from the microbes that you ingest in your food and drink. If you don't have acid in your stomach, those bugs are more likely to get through into the small intestine, where they may land and settle and proliferate. That's bad news. The other risk factor for developing SIBO is cicatrization or scarring of the ileocecal valve. When does that happen? It happens when you have sustained dysbiosis and chronic inflammatory stress in the large bowel that can eventually cause damage to the ileocecal valve, and that allows the passage of these microbes, which should be in the colon, to get into the small intestine, and now you're in trouble again. So those are the risk factors. Those are the types of people who are more likely to develop SIBO. And if you have SIBO, you can't eat prebiotic fiber until you flush those microbes out of the small intestine into the large intestine. It's a little bit like using L-mannitol to clean out the urinary tract. We use slightly different sugars to achieve the same effect in the small intestine.
Great. There's another question
Oh,
about
sorry. Did I say L-mannitol? I meant L-mannose. I beg your pardon.
Okay. What about epileptic seizures? Is it different to other brain diseases?
Yes. I mean, epileptic seizures are not like Parkinson or dementia or anything like that. You're talking now about an area of the brain where there is a tendency for excessive spread of neuronal excitation. And there's probably different things involved in this. There is probably, over time, you develop something called kindling, which means that the passage through certain aberrant neuronal circuits becomes easier. It's a bit like what happens when you memorize something. You're laying down specific contacts and circuits in the brain. If this wave of electrical discharge is keeping going, through different routes, and it keeps on doing that, eventually that will become a little easier, and the epilepsy seizure threshold may decline over time. There's probably neurochemical imbalances that are contributing to this as well. And it seems also that the composition of nerve cell membranes is playing a role, because, as I mentioned before, if you have an excessive ratio of 6s to 3s in your cell membranes, including your brain cells, including smooth muscle cells, those cells will become a little bit more ready to respond electrically to external stimuli. So I think that by using the pharmaconutritional tools that we use, which effectively take your metabolism, put it in a time machine and send it back 150 years to a time before ultra-processed food, I would expect that to raise the seizure threshold and make fitting a little bit less frequent. I don't think it's a cure, but I think it's something that might help the condition.
Good. I just want to move on a bit to, there are other things that people are concerned about, like dementia, Alzheimer, and Parkinson. What can we tell us? What's the magic recipe here, Paul?
Well, first of all, let me just repeat what I said at the beginning, and that is that the numbers of people, the frequency of these conditions is increasing, and their latency is decreasing. That is, we are seeing people present these conditions at consistently early ages, and that is telling us that, again, the environment that we have created for ourselves, that we're living in, is neurotoxic. What can we do to alleviate? Well, there are certain external factors that we know are really damaging. There are certain pesticides, for example, that have been linked to an increased risk of Parkinsonism. That's well described in the literature. We are to approach this from a more general perspective. I would say that a pre-industrial age diet it seems to reduce Parkinsonism. Dementia was known long ago. Shakespeare writes about King Lear, for example. And many of diseases were known and described by physicians many hundreds of years ago, including actually many thousands of years, several thousand years ago. Parkinson is a little bit different, because if you look for descriptions of this disease in nature, there's hardly anything before the Industrial Revolution. And so I think the case is saying that there is something in the way in which our lifestyle has changed over the last couple of hundred years is very definitely, contributing to the current pandemic, you might say. I'll talk about one particular case. We have this idea that Parkinsonism is degenerative and irreversible. I think we need to get away from the thinking of this as one disease. There isn't one form of Parkinsonism. There are many forms of Parkinsonism. If you look at the incredible complexity of what goes on in the brain, neuronal metabolism, neuronal genetics, the way in which genes switch on and off and express for proteins which act and interact in different ways, it's very clear that there are hundreds of different points in that complex web of factors, which, if they are compromised, could lead to a condition at the end of it all, which looks like Parkinsonism. So there's hundreds of Parkinsonisms, if not, among many hundreds. Having got that off my chest, I think what that means is there is no drug that's ever going to be very useful in treating it, because you can get to that clinical endpoint from so many routes. And I think that's why in many clinical trials of new drugs to treat Parkinsonism, you sometimes find, a couple of promising results in the early studies. When you go to larger studies, those effects seem to disappear, because you're dealing with a heterogeneous population. What that means is that I think that creates a cause and a logic for multiple intervention. No magic bullets. That's the drug company's idea, but many multiple nutritional interventions calculated to create an environment in the brain which is not pro-inflammatory, for example, which supports mitochondrial function, which we now also know is important, which supports proteostasis, that is the control of protein production, maintenance, and quality and disposal. All of these things are clearly involved. One particular case that I think stands out to me is a man I think some of you have heard me talk about this, a man in his 80s who came to me, who had the early signs of Parkinsonism and who'd been diagnosed as a Parkinsonian patient by actually a very famous neurologist expert. And I mean, clearly he did have Parkinsonism. I put him on a slight variation of the health protocol, and over the course of the next 2 to 3 years, all those symptoms that he had disappeared, ending with the anosmia. So the night terrors disappeared, the inability to, the micrographia disappeared. He went back to his neurologist, who was astounded, and actually I didn't, and said, "Oh, I must have made the wrong diagnosis to start with." He was covering his ass, basically. This man clearly did have early on Parkinson's at a very early stage. So I think if you change your lifestyle fundamentally and comprehensively at an early stage in the condition, I now think that you can stabilize the condition and reverse it. Can you do that in every case? Probably not, because as I said, there are probably multiple forms of Parkinsonism, but you never know which form you are. We don't yet have differential diagnostic techniques to decide which version you or a loved one might have, and I'm not sure we ever will have an adequate differential diagnostic. So what have you got to lose? I would say start with a multiple nutritional intervention, and I think that's going to salvage a lot of people. Some people will still get through and will require pharmaceutical support. But once again, given the serious problems associated with the pharmaceutical approach in general, they should be left as your measure of last resort and not used indiscriminately, which is the way most medics approach this, as the first line of defense. That's not how they should be used, in my view.
Thank you. There are so many things that I actually would like to do, but looking at the time, we're just gonna do a couple of more things. I know you had a long day, Paul. Just something when it comes to brain health that a lot of people complain about is brain fog in different situations. If it's pregnancy and brain fog and the pregnancy dementia, or it's could you talk a bit about the brain fog and the again, it comes down to how can we support?
Well, the problem with brain fog is it's not exactly a medically defined condition, and there may well be different ways in which the environment inside your skull might be malconfigured in a way that would lead you to feeling less cognitively effective. I think that restoring metabolic normality would be a good strategy to start with. And that would mean stopping chronic inflammatory stress, stopping dysbiosis, ensuring good glycemic control, and making sure that you have all of the micro and phytonutrients in your diet that we know are cofactors for all these different, thousands of different metabolic processes that are occurring in the brain. I have to say, I don't think I've had brain fog since I was at medical school, second year, which was when we all started drinking. and for me, I hated to add, that's when I stopped as well, because I didn't like particularly what it did to me.
Just one last one. I got a question about a bipolar disorder.
Mm-hmm.
Is there a I'm not even sure what to ask, but is there what can we do in a disorder like that? I know that we can't talk too much about, we do speak about conditions right now, but is there any specific things in bipolar disorder that you would like to mention?
Well, if you look through the medical literature, you'll find a number of references to the use of omega-3s in this particular condition, and some of the reports are rather positive. I think that if you combine the omega-3s with amphiphilic polyphenols, which you can find in oily fish or in olive oil, you're going to get better results, because we know you'll get better incorporation of the omega-3s into your cell membranes. So I tend to believe that this is an appropriate tool that you can use when dealing with that type of condition. And I've certainly seen very positive effects in people that I've had personal dealings with. I think we shouldn't forget Viva. We haven't talked much about that, but saffron is developing a significant medical literature. There are a lot of studies coming out now which says that saffron is as effective as methylphenidate in the treatment of neurodevelopmental disorders. I talked about that briefly, but when you talk about depression and anxiety, all these papers are coming out saying it is as effective as any of the pharmaceutical products in the treatment of these conditions as well. You can search for that yourself. Just go to PubMed and put in, for example, saffron anxiety or saffron and depression. And you'll see all these studies. They're all there. I mean, there's a lot of them now, and the more and more of them are coming out every year. Now, I like this particular herb. It has a venerable history. It was first described over 1,000 years ago by Avicenna in Persia. And it's devoid of the types of problems that we know exist with the pharmaceuticals that are currently used to treat these conditions. It's not addictive. It won't create paradoxical rage and mania. I mean, you might go out and shoot your next door neighbor if you're taking an antidepressant. You won't do that on Viva. It's none of these are addictive, and they're none, and saffron is not only not addictive, it is not associated with withdrawal symptoms. And we know, for example, that the withdrawal symptoms with some of the anxiolytics are severe, and with some of the antidepressants so severe that actually half of the people who are taking some of the antidepressants are not able to come off them at all. Perhaps even more to the point, there's a couple of papers that indicate that if you are taking an antidepressant and then you add saffron, the adverse effects linked to the antidepressant become reduced, and it actually becomes easier to withdraw from the antidepressant. So I think that with saffron, the supplement industry has actually come up with something to beat the pharmaceutical industry with, because frankly, the pharmaceutical tools that are currently used to treat the affective disorders are really lacking. They're not very effective. They are riddled with adverse effects. There are serious questions about their long-term safety. And I think they're redundant now that we have access to a herb which is safe, natural, and increasingly validated. As I said, go to the databases and find out for yourselves.
Thank you so much, Paul. It's so interesting, and I'm sure we could speak for many hours more, but I'm not going to do that to you because I know you had a long day. So I just want to thank you, and I think it's so good to see that in many things, and yeah, we have a lot of tools that we can use to support the body in different situations, and I think that's the most important thing for new people here. Please get back to the person who invited you in if you need more information or if we can help you in any way. And to you, Paul, thanks again. And I'm sure we're going to ask you another time for this topic or another topic, but we're always so glad to have you on our calls. And so thank you. And I wish you all a really nice evening, day, or wherever, whatever the time zone you're in. Enjoy.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Thank you. Thank you.
Thank you so much.
Thank you so much.
Thank you.
Thank